Hi, I'm Tatu Joy. I'm a oral medicine radiologist. I've been working in Kochi for over 20 years, happily doing diagnosis for a lot of patients from Maxillofacial Diagnostics. And I'm here today to share a few of my experiences and concerns which probably is not well known around, not just Kochi, even in India or the world around. So when I was doing my practice, I used to see a lot of patients suffering from TM joint dysfunctions. We could do the diagnosis, but getting them treated successfully was always a question. So I went around searching a lot of journals, studying a lot about it, visiting a lot of places, undergoing a lot of workshops, conferences, and then today I would like to share a few observations that I have seen over my sojourn into TMJ dysfunction. The TM joint is a joint that is placed right around here. It is one of the topmost or the highest joint in our body. If you look at it, it takes the maximum load when you chew on something hard. When I say hard, imagine somebody chewing on sugar cane. You can imagine the amount of force that is generated on that joint. You can also imagine when I say, even if I can sit idle, but when I talk, I need to use these joints. So I would also say, go a step ahead and say this is the most frequently and most commonly or most used joint in the body. So we have already mentioned two aspects. It is the most frequently and the most used and the most stress-bearing joint. Now to look at the anatomy or the way that this joint is structured, you see that it is structured on either side of the body. According to mechanical principles, the third point that you need to lift something that is on both the sides would be here. But God had different designs, so His design says that you don't have a muscle here to lift the jaw from here. So to get that, you have an oral cavity, and so that may be aesthetics and all that. So essentially, these joints are now functioning from the sides. To lift something from the side alone, you can think of a hanging bridge or something like that. Just to understand the complexity, you need to reinforce that joint with all the muscles all around. Now, all those muscles starts from right here to the back of your vertebrae. All over, everything, all the muscles are involved in such a joint being lifted. This is so that we all understand the complexity of this joint. Now, when a dysfunction, it could start from teeth, the way your teeth are not balanced properly, the way you bite. If you bite on one side, if you don't bite together on equally, it could be even a small thing as a small decay there, some sensitivity on one side. Your brain tells you to avoid that side, and you generally avoid that side. You start biting on one side. This leads to a dysfunction. That means a force transfer is not correct. Then you go into the joint per se. You have a disc which is there to cushion your bites. That disc is connected to a few muscles, and then you have a lot of arrangement that's going around. Now, till around 1980s, we as treating physicians of the TM joint, none of us really understood what was happening till Dr. Jangelson in 1970 identified that the muscle, the airway, the joint and the teeth, these four components play a very major role in helping these patients, correcting these patients. Correcting just one aspect would never correct the rest of it. So looking at it as a complex condition, and we need to correct it starting with the muscles, the joint and the teeth. Now, how do you identify if you are somebody who has this problem? Now, that is one major problem. If you notice, this joint is right up here. It is avascular, that means less blood supply. So the pain that it gives is generally never in the local place. Although you may have a little bit of local pain, mostly this joint gives pain that refers to the temple to the malar, behind the eye, neck, shoulder, back, and even you can have numbing or paresthesia of your fingers. So all these are the symptoms that are seen on the TMJ patients. There are a host of symptoms. Now if you go to any website, you can see all those symptoms. Now if you have, generally the patients that I see are people who have already seen a neurologist, people who have already seen an orthopedician, people who have already seen an ENT, because these pains they think are related to those areas. And if they have gone through your, there are a host of problems other than TMJ problems, and if they have seen that none of them exist with you, then probably you are a TMJ patient. So in which case you need to see a TMJ specialist. He will assess you and let you know what your problem is and how it can be corrected. Now correcting it is, we've started a new center at Kadavandara which does all the which we have equipped with all the facilities to identify and manage these problems. Generally what we do here is, if you are a patient who needs TMJ correction, you will be, we do ultra low frequency TENS, and we get your muscles relaxed. We check the EMGs, surface EMGs, find out if your muscles are all relaxed, and then we take a bite. That is probably the optimum bite with which you need to, because eventually you've lost some vertical, or your pitch, your roll of the jaw, the lower jaw is shifted. So correcting that is of optimum. And the moment you get that corrected, you can see that one by one all these symptoms and features of your conditions are just disappearing or vanishing. And this is essentially what I wanted to convey to you, because there would be a lot of unexplained pain. Unexplained is just because we have not understood it. The pain is real, but finding out the reasons, and now in my sojourn I have understood there's a lot of things that I've explained. I have had patients who have had chronic asthma. 2 of my patients, in fact, now do not have an asthma just because they're wearing the appliance. Now that is also explained scientifically in terms of the muscle realignment and all that. Okay, I don't want to complicate what I'm talking right here. Okay, and these are the few things. Essentially what I wanted to convey on this video is a lot of pains, that are headache, neck pain, shoulder pain, ear pain, sounds in the ear, and all these which are unexplained. And sometimes these patients who do not get the problem identified get into depression. It's also closely related to sleep apnea, and this is a roller coaster ride downwards, and nobody helping you with how to get this done. You are probably a TM joint patient. This is what I essentially wanted to convey in this video. Thank you.